name is Miranda Morgan. I've just been asked to give you some teaching about your disease. Is that all right? Okay, great. So we're just going to start off by talking about what this disease does to your body and how it occurs in the first place. So bleeding in your digestive tract is also often caused by peptic ulcers or sores that develop inside your stomach lining and inside the upper part of your small intestines. These sores may be caused by the use of anti-inflammatory medication, also called NSAIDs, like ibuprofen. And this happens because these medications block the secretion of the protective stomach lining and allows the acid to irritate the lining of your stomach and small intestine. The acid in your stomach is very strong and to digest food, but without that protective lining, it can really do damage to the inside of your stomach. So if this bleeding is not corrected, it can cause the body to lose too much blood, and this will manifest in symptoms like lightheadedness, fatigue easily, short of breath, and without enough blood in circulation, the body tissues do not get enough oxygen and they can't function properly. Also, there is a risk for abdominal infection that occurs if there is a perforation, which is just a hole in your stomach. So this is diagnosed numerous ways. One way may be a blood test. The doctor may order what's called a CBC, which is a complete blood count, and they'll do this to look at the amount of red blood cells and the amount of hemoglobin you have. Hemoglobin is just the little transport molecule in your blood that transports oxygen. And they'll also look at your hematocrit, which is just the amount of formed elements to plasma in your blood. So another test they may do is called an occult stool test. And this test is done to test for blood in your stool. And sometimes it may even be visible in your blood. Your stools may be darker and have a tarry appearance. And this could indicate a bleed. Another thing the doctor may order is something called an endoscopy. This allows for visualization of the digestive tract to see where the ulcer is. There's also a procedure called a nasogastric lavage, which may help determine the source of the ulcer. This is done with a tube that is passed in through the nose to remove stomach contents. And lastly, your doctor may order an abdominal CT scan, which allows for visualization through an image. Some modifiable risk factors. We already talked about the use of NSAIDs or anti-inflammatory medications. And to replace these, you could use things like acetaminophen, which has less effect on the stomach lining. Another risk factor is smoking increases the risk. Alcohol also irritates and takes away the protective lining in the stomach. And it also increases the amount of acid produced. So this contributes to the development of ulcers. Untreated stress is also a huge component. This causes the stomach to lose the protection as well. And eating spicy foods is another risk factor. So to treat GI bleeding, the first thing we want to do is stop taking ibuprofen, start looking at other treatment options. If anemia is severe, blood transfusions may be required. Your doctor may also prescribe what are called proton pump inhibitors. These reduce the amount of stomach acid produced. There are some over-the-counter ones like omeprazole and pantoprazole. If you use these for a long time, you want to caution that there may be osteoporosis and you may need a calcium supplement. Other medications include histamine blockers, which reduce acid production, and antacids to neutralize the stomach acid. Your doctor will make a plan with you for the best treatment. Um, if medications are not effective, or if you do get a perforation, the doctor may have to do surgery to treat. And lastly, diet modifications. So you want to avoid spicy and irritating foods like alcohol, coffee, caffeinated soda, fatty foods, and chocolate. Um, Also, if you eat a particular food and you notice it's irritating to you, you want to avoid that. Some people just have unique things that irritate their stomachs. You also want to avoid eating late at night, and you should get an adequate amount of soluble fiber, which is found in things like bran, barley, dried beans, and lentils. Do you have any questions? Thank you.